Hi, I'm Colleen Shields.
And I'm Jennie Grimm.
And we are
the
Momtastics. We provide tips, tools, and techniques for you parents out there
to make parenting a little easier
and a lot more fun.
Today we're going to meet with Dr. George Shields, an optometrist, who's going to give us some information about taking care of our kids' eyes.
So let's check it out.
Come on. Hi, Dr. Shields.
Hi there, how are you?
Good, how are you?
I'm good, I'm good. Very excited to be here.
I'm glad to have you. What age should we have our children see you for the first time?
They definitely should be seen by at least age 1 for their first eye exam. Thereafter, you want to have them seen at around age 3 and then at 5. And then thereafter, there are differences of opinion. I prefer to see patients every year thereafter, at least until they're age 18.
Now, how does the eye exam work for kids that are that young that can't read the letters on an eye chart?
That's a good question. Most parents say, I didn't bring my child in for an eye exam because I knew they didn't know the letters yet, so I had to wait till they were age 5. But there are different ways. Children are naturally, when they're born, especially infants, are attracted to contrast. So we use different gradient bars where we'll have black and white contrast bars, and the eye is naturally attracted to the chart with contrast, and so we'll show them one side that has gray and one side that has big black and white bars, and the eye naturally will want to look towards the black and white bars. We will then get smaller and smaller as far as the different gradient bars. So we start with real big, wide black and white bars, and like clockwork, each and every time they look, when you show them that chart, their eyes fixate not at the bland gray chart, they look right at the black and white bars. We get smaller and smaller, and by doing so, we're able to figure out what their acuity is.
So even if they don't know their shapes or their numbers, they can still be effectively seen, and you can determine if there's a problem.
Oh, there's a very good way for us to quantify what their vision is at age 6, 8, 9 months. Now, as they get older, they learn their shapes, like what's an apple, oh, that's a house, oh, that's a bird, that's a horsey, and there's different ways, there are different charts at different levels. But even as an infant, we can determine pretty accurately how well they're seen and whether they have a lazy eye or they don't have a lazy eye, which is one of the things that sometimes pediatricians can't pick up. They pick up gross things like tumors that may form in the eye prior to age 6 months, like retinoblastoma, which is the most common childhood type of cancer, most common thing that pediatricians are looking for. But we do a lot more tests.
What are some of the other things that that you as an optometrist can discover that a pediatrician checking your child's eyes might miss?
Are the eyes coordinated and working together? Is one eye weaker than the other? Eye dominancy? Do we actually have a lazy eye? Are they farsighted? Because you can see the charts. A child may be able to read the charts, the 20/20 charts, both far away and up close if they're farsighted. But it may just be that they're focusing excessively. So they may have a high prescription. The pediatrician may not even be aware that they have a high prescription, but that could adversely affect how they perform at work, school.
Yeah, what are some of the signs that my child may be experiencing problem with their eyes?
Some common things that the parents sometimes will dismiss are they blinking excessively? Do they wink? Do they look from odd angles? Are they rubbing their eyes? Are they getting headaches? Do they have an aversion to looking at books when you're trying to read to them? Do they have a lack of concentration levels?
Say that we bring our child to you and you determine that there is a problem and that glasses are necessary. What's something that we want to look for when picking out lenses for kids?
Well, with respect to glasses, you want something that's lightweight, something that's durable. Spring hinges are important for glasses because the kids are kids, and they're going to be rough and tough, and they don't always pay attention to all the details. Ones that have flexible beta titanium, which is a hypoallergenic material. Some people are allergic to some of the metals. Is something you want to look for. You definitely want to have a scratch guard on the lenses, and you want a shatterproof lens. You want what's called a polycarbonate material, which everyone should be using for that, so that it's impact resistant. They get hit with a kickball or a volleyball or something, that it won't shatter. It protects the eyes. Now
here at Embassy, you carry very kid-friendly frames that have characters that are hugely popular, like Scooby-Doo, and so they're bound to find something that they like.
Oh, absolutely, and sometimes we'll have children that come in because their friend at school actually just got a new pair of SpongeBob glasses, and all of a sudden, they can't see, and we have a lot of different tools that are at my disposal to make sure that they actually do need glasses, and not just desire glasses, and we have some that really, really desire glasses badly, and so
with that
much that
SpongeBob and Scooby-Doo logo on
yes,
it.
yeah, a lot of the young children are very brand conscious at
That's
times.
great.
So we have a lot of the different brands, but all our frames that we have are durable and tend to be pretty resilient. And
Now, for the maybe the teenage girl who's a little self-conscious about having to wear glasses, at what age can kids start wearing contacts?
it was considered at around 12 for girls and 13, 14, or 15 for boys in years past when I was going to school. There have been some articles in the past year that have demonstrated that the children are no more likely to have infection or have corneal problems, eye health problems, if they start even as soon as age 8 versus 12. No clinical difference as far as increased risk. But the most important aspect or thing for a child to have if they want to wear contact lenses is just that. Is that they want. They need to be motivated. And sometimes we'll have parents that really want their child to have contact lenses, and that's really not enough. And the second thing that they need is they need to be responsible. So you need to be motivated and responsible. If they're motivated, they're responsible, we can teach them, and we'll teach them good techniques, good habits, get them on the right path, and they'll do very, very well. Most of the time we'll give them disposable contact lenses, and that will reduce the risk of infection and complications.
Okay, now you just mentioned infection. I have to ask you, what is something that I can do to keep that disgusting pink eye as far away from my kids as possible?
Clean the toys and wash your children's hands. Purell is great, but kids touch everything. They touch everything, and they're scratching underneath their arm, and then they're rubbing their eye, and that's just kids. And so you try to keep them their hands as clean as possible. That's really one of the best things that you can do. The single best thing is to wash their hands, and also wash things around them.
Great. Well, this is wonderful information. Dr. Shields, thank you so much for spending time with us today. For more information, please visit our website at themomtastics.com. Embassy Eyecare is located on 234 Main Street in Annapolis, Maryland. You can call Dr. Shields to make an appointment at 410-268-8200.